prostate cancer, yeah, big deal, big deal, big deal. And yeah, it's something that happens quite a lot in this part of the world, but a lot of
Yeah.
Nigerians do not know it. Let's start with why that is, first of all.
Okay. To know why that is,
Yeah.
it will probably be important for us to know what it is all about first and
Okay.
foremost. A lot of people do not know where the prostate is.
Mm.
The prostate is an almond-shaped gland that is found around the penis, in between the bladder and the urethra. So it's almond-shaped, and the best way I like to explain it is: imagine you have a pipe through which water is going through, and you have a something outside just compressing around the pipe. So it's similar like that. That's what we call the prostate. And what does it do? It is responsible for producing semen. Semen is the fluid that carries sperm from the urethra through to the penis. We also have the prostate providing nourishment and nutrition to the semen, making sure that it remains in the healthy state that it is. So it's a very important gland in the body, especially when you talk about fertility. It's very, very important. So why do we have it prevalent? Just like a lot of other disease conditions, will be the fact that our lifestyle is a big issue in this part of the world. The things we take in, the things we eat, the things we drink. There's also the part of age. There's also the part of race. So it's been, from research, has been shown that blacks are more likely to have prostate cancer as against whites.
Why is that? Is our prostate different from that of whites or that of the brown people? Why are blacks more susceptible to it?
Yeah, it's a lot. It has a lot to do with genetics, and some of these things we can't explain. But it has a lot to do with genetics. The genetic makeup of a black man leaves him susceptible to getting a lot of these conditions. It's not just prostate cancer. A lot of these other conditions, ovarian cancer and the likes, are more common in the blacks, and it just has to do with genetics compared to the whites. Also, the fact that there is a better health-seeking behavior with the white people. So they just feel a slight pain on their middle finger and they are going to the hospital. But for us here, I like to say we practice what we call God forbid medicine. We practice what we call anointing oil medicine. We practice what we call holy water medicine. So the thing would have gotten far, and then we now realize, okay, we need to go to the hospital. So these are some of the things that also play a role in it being very prevalent in this part of the world.
There are a lot of sicknesses, that have similar symptoms.
Yes.
So does prostate cancer have, similar symptoms with anything, so that people don't, get scared unnecessarily?
Yes, definitely. As I said earlier, a lot of the symptoms doesn't necessarily mean that it is prostate cancer. I remember I mentioned what we call benign prostate hyperplasia. That is just enlargement of the prostate with years. Over the years, the prostate will gradually enlarge. In any man, the prostate would definitely enlarge. Now, will it enlarge to the point where it will cause some of these symptoms? For some people, no. For a lot of other people, yes. Especially as they age. So that can be one of the possible conditions that might cause some of these symptoms. There's also something we call prostatitis. Prostatitis is just basically the inflammation or infection of the prostate. So if the prostate is infected, definitely some of these symptoms might definitely come up. So the only way we can find out if it is either of these or even prostate cancer is by testing. And by testing, we are talking about what we call the prostate-specific antigen test. You take the PSA, you take the sperm, and then you test it for what we call prostate-specific antigen. Now that is something in the prostate, produced by the prostate, that shows us if the prostate is healthy or not. There's a normal value between 1 to 5, normal value. But once it begins to get, for some people you test and you're seeing a PSA value of 100, 200, then that is a big problem. That is something that will tell us that
from 5 to 100. Wow.
You can imagine. So that can give us an idea that, this person the prostate might be moving on to the level of prostate cancer. And while we encourage everyone to get their PSA test done, it's also the prostate screening. That is is regularly done, and for most times, most people that do it is free in a lot of facilities. So you get your screening test done, they check your PSA levels, and then that can help us know if you are dealing with prostate cancer or just a prostate enlargement or just prostatitis.
Okay, so what kinds of men are most at risk of prostate cancer? Everybody, young men, old men, what kinds of men?
So because the prostate enlarges as a man ages, it's usually is dependent on age. So the older the man, the more likely he is to come down with prostate enlargement or prostate cancer, as the case
Is
may
it
be.
saying that no young people can get it?
No, I'm going there. So initially, it used to be a lot of the diseases we are dealing with now used to be diseases of the old, but now we are having people who are in their they have not even gotten to 40, or they are in their early 40s, coming down with a lot of these conditions. For example, prostate cancer. And I'll take it back to lifestyle. A lot of alcohol consumption, a lot of smoking, a lot of unhealthy lifestyle. Let me mention this, that for people who consume suya a lot,
Are you serious?
is a problem. Because heavy consumption of red
Doc,
meat.
wait
I know I'm
first.
shaking tables.
No.
I know I'm shaking that your
This
table.
table.
So I need to say it.
Wow.
Consumption of red meat,
Hmm.
and I'm using suya because that's what is very,
That's
very.
what's
There are
very
some people
common.
that every day they consume a lot of it. So heavy consumption of red meat, smoking, alcohol are hugely implicated in prostate cancer, and we have a lot of young people doing that these days.